treat.
Hello, I'm Dr. Richard Rothman of LASIK of Nevada. I wanted to take a few moments today to review just some simple ideas about what exactly those eye prescriptions mean. Many of you have seen the numbers scribbled on a white piece of paper and kind of perplexed and wondering what that exactly means and how does that apply to me and how does that affect my candidacy for the LASIK procedure. So just as a simple way of approaching this, we'll break it into three parts. Nearsightedness is the first category, and that's probably 70 to 80% of the population. Farsightedness, which is probably the other 20 to 30%, and then astigmatism, which is shared by both groups of nearsighted and farsighted patients. So what is nearsightedness? Well, nearsightedness is pretty much exactly what it says. It means you can, without your glasses or contacts, you could see near clearly, but you're fuzzy far away. Now that makes sense to me, and it does to most patients as well. And what we do with LASIK is take that near point of clarity and move it out to distance. And that's how LASIK works. It takes the nearsighted person who's focused at near clearly and moves the clear point out to distance so they can function better. So nearsightedness is probably the easiest one to understand, and it makes sense. Farsightedness really makes no sense at all. What farsightedness means is that you can't see near or far very well after the age of 30. And why that name came about is that nearsightedness is a minus prescription, farsightedness is a plus prescription, so near and far are kind of the opposite, like plus and minus. But really what farsighted people see is not very much. In fact, I sometimes jokingly say it's can't see anywhere sighted, especially after age 30. So what farsightedness means is that we have to change the shape of the eye to bring the focus from where it's totally out of focus to a place where it's in focus for distance vision. And we do that by microscopically steepening the cornea. Now for nearsightedness, we accomplish that goal by microscopically flattening the cornea. And when we talk about steepening and flattening, we're really talking about tiny little units called microns. The whole cornea itself is about the thickness of half a human hair, 500 microns. And most of our treatments actually are 1/10 of that or less. Now we do treat people as high as -14, that's nearsightedness, and we treat people pretty much as high as +6, which is farsightedness. So there's a wide range of treatment, all the way from -14 for nearsighted folks and +6 for farsighted folks. And that pretty much explains most prescriptions, with one exception, astigmatism. And people always wonder what that means. It's a very simple thing, actually. It just means that microscopically, the eye is shaped a bit more like a football, and if these are the 2 points of a football, there's a flat curve going between the 2 points in this direction, and a slightly steeper curve going in the opposite direction. So my job, as I like to say, is pretty much turning footballs into basketballs, or creating an image that focuses evenly in all directions. So whether you have nearsightedness, or farsightedness, or astigmatism, or any combination, the lasers that we use will create the proper shape to give you an even focusing point on the back of the eye. And that is how we correct vision with LASIK, or PRK, which is the alternative procedure using the same laser technology. I hope you've enjoyed this explanation. I'd be happy to get into more detail in person, and we look forward to meeting you soon at your consultation, and look forward to joining you on your journey to better vision without glasses or contacts. Thank you very much.